to you here. It is late April and we are in the middle of a pandemic. So I'm going to show you a little bit about my daily life here at clinic and what happens when someone drops off an emergency dead hearing aid. We need to be able to hear. It's really important. People need to hear governor announcements, health news, and be able to protect themselves. And sometimes the captions on TV just aren't that great. So when a hearing aid arrives to clinic, it will come in this green box that is reusable and cleanable. The hearing aid will arrive in a disposable baggie. So before I even touch this green basket with the baggie, I have to suit up and protect myself. People are wearing masks, and if they're not wearing masks, whether or not they're wearing them, they might cough into their hand or touch a surface that might have a pathogen on it and then adjust their hearing aid. Especially if you're wearing a mask, you're having to make sure that your hearing aids aren't being slingshotted off of there. So we have to, definitely protect ourselves as clinicians to make sure that we are not being infected by pathogens that might be on the hearing aid. So the first thing I do is make sure my hands are nice and clean. The next thing I'll do is actually protect my hair, because while you're brushing off wax and cleaning out nooks and crannies of a hearing aid, you have no idea what might be splattering into your hair. You certainly don't want to touch that later on and then rub your eye or something. So I have this really cute shower cap that I've been reusing, and I just give it a nice good spray with rubbing alcohol, and then I take it home and I wash it every night. So now my hair is nice and protected. The next thing I do is put on my mask. So I'm doing all of this with clean hands, and it's a clean, fresh mask. Make sure that my eyeglasses are not in the way of the mask. Then I will install my fresh, clean listening mold. This is something we use to listen to hearing aids and check them for distortion and feedback. And this is a custom mold just for my ear. We have 2 tips on this. I might as well show you this now. This one's for behind the ear hearing aids that need an ear mold, and then this one is for in the ear hearing aids. Behind the ear mold, in the ear custom hearing aid, and then this is for receiver and canal where we're just holding it up to a little speaker. The last part of this, because my eyeglasses are not good eye protection, something could fall into there. These lovely masks were made by a company called Ear Lens. So I widen up this strap here. It's got some very good Velcro. And then I just kind of set that around my shower cap and then tighten it. So now I am super protected. I then put on some gloves, and I'm not going to do that for the purposes of this video, but before I even touch the hearing aid, I am gloved up. Everything is protected. I'm also wearing a lab coat in my lab. When I'm in my treatment room, I don't necessarily wear a lab coat, but this is only for personal protective reasons. So once the hearing aid comes out of here, and this is a demonstration hearing aid, it's clean, it's not anyone else's. This goes immediately in the trash. I transfer onto a nice clean paper towel, clean up the hearing aid with some special solutions that will kind of stay wet on the hearing aid, not in the microphone portions, just on the shell portions that we touch. So I let that penetrate for about 3 minutes, and I use the hearing aid spray by Audiologist Choice. Once I replace all the components and I check it and I listen to it when it's clean, then I return it in a fresh, clean, brand new hearing aid case, just like that. So then I can return it to my front desk. The green basket gets cavity wiped and it dries before anything else goes into it for the next patient. So even though this takes a long time, it is super worth it to make sure that I'm protected so that I can help as many patients as possible so that they can hear their best through this really crazy time. So anyway, that was just a look into the daily life that's going on in audiology and how we're working really hard to protect our patients and making sure that they can hear. Thanks for watching.